if a patient has a compensation during the closed kinetic chain of movement, you have to test a manual muscle test as well in the closed kinetic chain. So for this case, a contralateral hip drop during the stance phase of running, we have to be able to test the gluteus medius while in a closed kinetic chain while in stance phase. So for this example, I'm going to have Nick go ahead here and balance facing this direction on his left limb. So go ahead and come up here and bend your right knee on that stool. So now we're putting him in that stance phase of the running cycle. Often when I perform this technique, I'm going to have a mirror that's right behind him so that I can visualize and see in that mirror his pelvic alignment. I'm going to come into a kneeling position. He's resting in this position so the hamstring is put on slack and it's not active. He's balancing or stabilizing himself on the chair. So we're taking the stability and coordination component out of it. I'm then going to come in towards his pelvis. I'm going to place the palm of my hand over his ASIS and the palm of my opposite hand over the posterior aspect of his pelvis. I'm going to get in nice and close. I'm going to interlock my fingers and compress in through all that soft tissue. Once I get a good purchase, anterior and posterior, I'm going to have the patient maintain a level position and go ahead and don't let me pull you downwards. I'm going to apply a directed force down towards the ground and slightly towards his stance limb. Hold, hold, hold. Don't let me pull you down. And excellent job. He maintained his pelvic position. Now let me show you what a failed test would look like. I come into the same position. I interlock. I stabilize. I'm going to have him hold that position. Hold, hold, hold. And then a failed test is where the pelvis starts to drop down and dip. Now remember, we're testing that left gluteus medius.